We are back again with Grazel, and today we're talking about a technique that therapists tend to use, which is called mirroring.
Mhm.
So, Grazel, tell me what is mirroring?
Mirroring is such a crucial part of emotional development. I think it's clients need to understand that having parents that didn't make you feel seen, heard, validated, guide you to name your emotions means that your therapist, when you go into therapy as an adult, will have to do all of that mirroring that you lost it in childhood from your caregivers in order to create secure attachment. So mirroring is not just something that we're doing just to repeat or say what you shared. It's actually working more internally and making sure that you have the ability to feel that you have the space to feel seen in the room, to feel validated, that all your thoughts and feelings make sense. And that's such an important part of healthy emotional development, especially in attachment theory.
Yeah, so with mirroring, is it more to do with your body language, or is it more to do with your words, or is it both? How does it work?
It's both. It's both, right? So let's say, the patient is saying something that's threatening, but they're smiling.
Mm.
Then I have to mirror the appropriate body language for something threatening
Hmm.
and the appropriate words and language for something threatening
Hmm.
and the affect to feel more congruent and consistent so that you know that you're securely aligning with what you're naming and what you're presenting.
Hmm.
Does that make sense?
Kind of. So I know it's all about creating that secure attachment and sort of building trust. And it was really interesting you said it works on more of like a subconscious based level than a conscious level. Um, if in that instance, for example, if someone was talking about something that happened to them that was really, really unpleasant, but they're smiling about it, does that mean you as
Mhm.
the therapist smile when you're talking back to them?
Um, okay, I can see what you're asking. Do I mirror the incongruent affect
Yeah.
that is attached to what they're sharing?
Mm.
Um, no, I mirror the actual, I don't mirror, but I play the actual correct and appropriate affect for that narrative.
Like this is what your face should look like when you're talking about this thing.
Right. I would probably say, oh, I noticed that you're talking about something really scary, yet I'm wondering if you noticed that you're actually smiling about it.
Mm.
Like just making what's happening explicitly in the room, because sometimes we don't notice what we're doing,
Yeah.
right? And
Yeah.
that's part of insecure attachment or part of masking or a coping mechanism that we've learned to feel safe.
Yeah, and that's definitely one of my things when I'm talking about something uncomfortable or something that's upsetting for me. I'll tend to laugh, and it's not
Mm.
a conscious thing. It's just I'm uncomfortable talking about it, so I'm going to start laughing. Um,
Right, you make it lighter.
yeah.
Yeah, so that's kind of the way that you've softened the discomfort, and that's a coping. But sometimes you probably don't know how that's impacting another person, right? So we want to just have a dialogue about it. It's like, hey, I noticed that you're smiling about this. Maybe I'll smile a little.
Mm.
Um, but I'm wondering what that means for you. Where did you learn that? So does that mean that the discomfort you're feeling is something that was never given space growing up, that you have to make it lighter on your own?
Careful, you'll make me cry.
Oh.
um, yeah, I can imagine from the client's perspective, if the therapist is kind of constantly mirroring them, it can feel a little bit maybe mocking or just make them feel a bit uncomfortable.
Ah,
You ever come across that?
yes, yes. I think this is I think Patients talk about this in a way that, because usually when, my associates, I usually check in with our individual patients and couples to see how everyone's doing in the practice. So
Mhm.
we usually ask for their feedback. And one of the feedback that we get is that they've gotten from other therapists, is that our previous therapists also have just kind of repeated what we've said,
Yeah,
right?
that's kind of it.
Repeated what they've said, and there's no follow-up deepening question. I think it's okay to repeat and use the patient's language, but there's got to be a purpose. So if the therapist is just repeating it, I don't, hmm, I wouldn't call it mirroring. I would call it repeating, but there's probably a purpose behind it. It could be that the therapist is wanting you to talk more. It could be that the therapist is wanting you to feel more of what you just said
Mhm.
or to linger more in the emotion. However, if it's just repeating basic words, I think there's got to be a follow through where, like, let's say you said something to me, and I just repeated it, and then I ended there. Of course, as a patient, you're going to be like, why did you just repeat what I just said?
Yeah, because that's a weird thing to do. You don't ever do that in a conversation. Just say the same thing back and just leave it there.
Right, right, right. And so, of course, I'm going to validate your experience. It's like, well, yeah, was there something more there? So, what I would say, it's more kind of, it's a repetition. It's not mirroring. It's a repetition of the repeating the words that's used. However, if you take it deeper, it's go repeating something with meaning is a reflection with meaning, and that can go under mirroring.
Right. Gotcha. That makes sense. How does that change when you're in a couples therapy scenario? Because you've got two people to try and mirror there. How do you handle that?
Well, I mean, I can go on and on about this, but this is what EFT is so good about, is that, and I mean, if you really take it outside of just the treatment modality that we use, and in this case, EFT, in general, the way we view things makes sense based on how we view the world.
Hmm.
So if somebody says you're viewing it this way, the way that you're viewing it is wrong, it's wrong in their view, but it's not wrong in your view. So you can mirror and validate each of the partner's experience. Oh, when you're sharing your experience and it lands to your partner as if you're wrong, I can see how sad that is. But to me, it makes sense based on how you're viewing the situation. That's smearing, that's validating.
Hmm.
Validating that your experience makes sense and there's nothing wrong with it. And I can do the same thing to the other partner by having them witness my process with their partner. And I do the same thing for the other partner. I'll say it makes sense that you want your partner to join you in your view because you want to feel connected,
Yeah.
right?
And I guess that's something you sort of train the couple in to do to each other as well, to mirror each other, because as you say, it's about that affirming their experience and validating it.
It's affirming, validating, making sense, normalizing, right? Normalizing healthy dialogue.
Yeah.
And and I think it's part of the de-escalation process is to make sense that again, you said this earlier, you're learning more about EFT now. It's the cycle, it's not about being against each other.
Mhm.
The couple is against the cycle,
Yeah.
and their each of their experience matter and each of their experience makes sense.
Hmm. So, last question on this topic. How is therapeutic mirroring different from just like polite conversation that you do with a friend?
I think, you don't have to be a therapist to be able to mirror another person's experience. I think that just comes so naturally for us, especially when we've been mirrored in the past in our upbringing. So I want to just normalize that it's in us. You don't have to be a therapist. So I think a lot of friends can do that. There's some friends that are better at mirroring than others, and that's probably because of different factors. It could be cultural,
Mhm.
it could be a loss of secure attachment growing up. But for those that have mirror better, extremely well can also be a problem because it could lead to codependency. So you just kind of have to gauge it. So the difference is there's not much difference, but I think the therapists, when we mirror, there's a lot more layers to why we're doing it. And that's what we're taught in school.
Yeah.
It's just there's just a lot more
I was
to it.
I was wondering if there's the difference is the fact that there's more intent behind it.
There's purpose, there's science behind it. We're trying to make sure that the receptors are working in transmitting neurons that was missing back then by mirroring. And I mean, you don't see that happen when we're talking, but that's kind of we're closing the gaps in your brain. So that way you can form a better alignment within yourself, right? So there's a lot more layers to it. And
Yeah.
it's repetition. We have to do it over and over again. With a friend, it's probably once a month or once every year or.
Yeah. And, we can talk about neuropsychology, neuroplasticity stuff till the cows come home, probably. But we'll
Yeah,
leave
we
it.
can geek out about the science behind it,
Yeah.
but yeah.
But we'll leave it there for today. Thank you so much again, Grazel, and I'll speak to you again soon.
Okay. Thank you, Scott.